my videos of late, and I've mentioned a correlation or possible correlation, at least anecdotal research, to suggest that women who are either menopausal or premenopausal develop itchy ears. And this is another case. This patient began her menopause a few years ago, and at the same time she developed this ear condition, otitis externa, and now she has to have it cleaned every 6 months. So we're just in the left ear. Now there's a lot of dead keratin, so dead skin, and also some dry earwax. The patient's ear canal is narrow laterally, so near to the entrance of the ear is quite narrow. And then where the second bend is, so where the cartilaginous portion of the ear canal, so think about the ear canal in thirds. The outer third of the ear canal is made up of cartilage, and the inner 2/3 is made up of bone. At that juncture, so the osteocartilaginous juncture, the ear canal widens a bit, so that it's the cartilage portion that's quite narrow. And that could also be a potential reason why her ear is getting blocked. So as the wax and dry skin is trying to migrate, it's getting trapped at the narrow. You can just see here where the ear canal is, it narrows and it widens again. I just used an ear hook combined with suction to remove the drier, more lateral plug of wax and dry skin out of the ear. This is a bit deeper now. This is beyond the cartilaginous portion. We're on the bony part now. So we're going to be a lot more gentle on the bony part, because whereas the outer third of the ear canal is cartilaginous, so it's semi-flexible and semi-sensitive, and there's a thick layer of skin about 1 millimeter in thickness. The inner 2/3, the bony part of the ear canal, there's just a very thin layer of skin, 1/10 of the thickness of the skin that lines the cartilaginous portion, that is attached, adhered to the bony part of the ear canal. There's no cartilage there, so there's no buffer. If you make contact with the bony part, it won't be a pleasant experience for the patient. So we're just trying to wriggle this out. I think I'm going to use some forceps to also see if I can just pinch this out, but it was quite strongly adhered. So I believe I'm going to just put some olive oil drops in and spray in a moment. So this is kind of lodged, because this plug is larger than the narrow part of the ear canal. It's hard to bring forward because it gets trapped. I think I just put some olive oil in there. And what olive oil does, it just lubricates the ear canal. It also lubricates the suction process. It doesn't get blocked as you're vacuuming. It helps to bind the dry skin and wax together, which then enables me to coax this out of the ear. You can just see I'm wriggling it through the narrow part of the ear canal. So there's one lump. And then it's coming out quite easily now in pellets almost. And just see how dry that is. And as I'm entering the ear, you may have seen how bad the patient's otitis externa is. Very dry, rough skin there, very sore, tender skin. The patient has got some treatment for it, but even with the treatment, she's still suffering from it, and sometimes there's not much you can do, unfortunately. I think patients also have allergy testing. She's seen an ENT doctor, seeing a dermatologist. And it's a very hard thing for a patient to overcome. Hoping that it's just post-menopause that her symptoms improve. There's more don'ts than do's in this case for the patient. So we've discussed with the patient to avoid water into the ear, and also don't poke in the ear canal. So you can see the bony part of the ear is really healthy. So it's a nice skin complexion. There's not too much dry skin. It's just more laterally where the patient's getting her otitis externa. So I'm just mopping up now. So again, this is the cartilaginous portion, and you can see the ear narrows and it widens. So where that rim is, on the top of the screen, that's the point where the cartilage turns into bone, and that's the patient's eardrum, so that looks pretty healthy. Just onto the right, you can see again laterally on the cartilaginous portion, the outer third, just how dry her ear canal is. Just using an ear hook, it's pretty dry, just trying to stab it in to the core. As I'm bringing it forwards, I've just got to be careful that I don't embed the tip of the hook at the base of the ear canal and scratch it. So it's just got lodged near the entrance. And slowly but surely, it's almost out now. You can see all the dry skin. You can see some of the fresher skin on the periphery on the outside, whereas the core's a bit darker, so it's oxidized. So lovely, healthy eardrum. I'm just going to mop up around the edge. Again, similarly to the left ear, the outer third is the part of the ear canal that's really dry. And to get the bony part, it looks pretty healthy. It's really crusty here. I'm just trying to lift this off the canal wall. Just some dry skin here, just trying to hide, trying to stay out of sight. Managed to get that out, and there's some just at the roof to the left. So we're just going to gently peel this off. So why do people who are menopausal or premenopausal tend to suffer from dry skin? So it's well known with menopause, it changes their hormones, and some of the epithelial skin is unable to retain the intracellular fluid, the water, the moisture inside the cell, so the skin dries. They tend to dry in other areas, which I won't mention. But again, for me, I have noticed an anecdotal link between dry ears and dead skin and otitis externa and even keratosis obturans and women that are suffering from menopause. If anyone's watching, a subscriber or follower, and if they obviously can add to this anecdotal research by leaving a comment, it'd be very much appreciated. Of course, don't feel obliged to, because otherwise others may know your health history and you may not want them to do that, so don't feel you have to. But I know in some past videos a lot of people have made reference to, and they find it quite reassuring that they can put a link to their conditions and the onset of it. So just some dry skin at the roof of the ear canal. This is just beyond the osseo-cartilaginous juncture. And just managed to just peel that away though. There you'll get a view of the eardrum in a moment. That's nice and healthy. Patient can hear a lot better, and you're going to see a close-up of some of the dry skin wax that I removed. See some parts are quite dark in complexion, so they're the oxidized bits, they're the bits that have been there longer. The more lighter shade, the fresher dead skin and wax that's built up in the